what we want to do with this workshop is make sure that people get the tips, tricks, tools, strategies that they need when navigating their teens' mental health, because it can be really a tough time in general, and then when we add on mental health challenges, it can be that much tougher. So could you maybe take us through, just kind of set the tone for us in understanding what some of the key challenges are that families often face when they start to maybe get an inkling or a feeling that something may be amiss with their child that they might need to address as it relates to mental health?
So there are lots of different places along the way in anyone's particular journey where you can identify where something goes wrong. I always tell families that you should listen to your gut, that families are experts on their kids, right? We know every bump, scrape, bruise. We also know every little thing that maybe our child hasn't reacted to the way that we thought that they were going to, or it seemed off from the way a lot of other kids may have responded. So there's a lot of different things that we are always thinking about when it comes to our kids. And of course, as parents, we're always thinking about all of those things. When we're looking at and thinking through our kids, especially in teen years, thinking about some of the ways that kids respond can be a little bit challenging, right? Because as teenagers, of course, there are those years where kids are in their room, they're on their phones, they don't really want to interact with us. But thinking about some really key factors that we can all start to pick up on. Things like maybe not being as interested in a lot of the things that they used to be interested in, maybe changing the type of people that they were hanging out with, or not hanging out with anybody anymore, spending more time by themselves, more kind of isolating behaviors. And then of course there are some of the typical things that we hear about, like changes in mood. Maybe they're looking more depressed. It could also mean that they might seem more angry than they normally would. And, you know, everybody has times where they're angry or a little bit upset, but sometimes it may just seem like it's a little bit more than you would expect from your child. So, you know, banging doors, storming off, leaving the home, and, you know, not saying where they're going, taking risks that seem like something that your child would never have really done before, are some of the kind of warning signs that just you might want to look out for when it comes to your child, and thinking about, you know, maybe I should talk to someone and start to parse out whether or not something is happening here that's a little bit different and I should start to pay attention to, and maybe get some supports either for yourself as a family and or for your child.
One of the things that I always say to families is we're talking more than that typical teenage angst. There's a lot of different life changes happening, lots of transitions, hormones are at play, and we're trying to figure out how to navigate the world and our sense of identity. And so that's always going to have a little bit of an edge to it. But when it really comes down to it for a mental health challenge, it's very stark behavior changes, isolation, and feeling like there's nothing that can bring joy or happiness, right? I think oftentimes we see children have a hard time with just having fun, right? Things that used to be fun or that they used to enjoy are no longer things that they're enjoying. They tend to have a short temper and a short fuse a lot of the time. And so I think oftentimes as parents, we can start to feel that things are off and different. So once we have some idea of what's going on with an appropriate screener, maybe from the pediatrician's office, maybe then we decide, hey, I think it's a good idea to have a therapist involved. There are different ways that we can approach therapy. Each therapist has their own unique way of kind of interacting with the children and families that they interact with. All of that can get really overwhelming to think about as a family. And so what are some tips and tricks that you could impart on families who are on a journey towards finding a therapist? Like, how do you even begin to know who the right fit would be?
My first tip is to ask questions. A lot of times people are busy working, and there's, as you probably have already experienced on some level, a ton of acronyms or words that are used, and sometimes it just goes over our head and we don't really know exactly how to understand it, or we're trying to figure it out in the moment. And so that can stop us from learning more information. So don't be afraid to stop people and ask questions, or say, would you mind pausing right there? Because you use a series of letters and I have no idea what that means. Yeah. We are our child's #1 advocate. We're going to know all of the things that happen to them, or we're going to be the ones that are right there along the way longer than anybody else. So us knowing as much language as we can and understanding the process is absolutely vital, more than probably any other tip that I could give you.
As a provider, it's really amazing, and it's one of the things that I always look to do is to empower families to be active participants in the process. One of the things that I always say to families, especially when it comes to looking for a therapist, is really sitting down and with yourself and with your child, right? It should be a collaborative process. That's how we help kids to gain skills, right? If you can, is to involve them as much as possible in the process, right? So you're looking for a therapist, identify what are the things that are important to you in a therapist, and have your child identify that. And when you go and you talk to a therapist, even if it's somebody that came highly recommended from somebody that you know, making sure that you're going into that interaction looking at it as it's an interview, right? You're also looking to see if they're a good fit. You're not just waiting for them to tell you that they can help you in your journey, right? Oftentimes we'll help families and parents to come up with a list of the things that are important to them, the questions that they want to ask, right? And so every therapist is an individual and is a person, and we're all bringing a different aspect to the role. And so questions like, what is your style of therapy, for example, right? That's a very basic question. And somebody might say, oh, I'm a cognitive behavioral therapist, which is somebody who focuses on thoughts, feelings, and actions and their interplay. Or somebody might specialize more in trauma interventions or different things. And so you want to get a basic understanding, but also even understanding, hey, when we disagree about something that's going on in my child's life, how are we going to communicate about that, right? Children's mental health is very much similar to what we say about raising children in general. It takes a village, and we all need to be on the same page in order for the best outcomes to happen, especially when a child's mental health is at play.
Definitely. And some of the ways that you can easily engage your child before having those conversations with a provider are the really simple questions. Do you want to have a male or a female? Do you want to have a person of color or a person of a specific ethnicity? If you're a family that speaks different languages, do you want to have somebody who speaks the native language or the primary language that's spoken in your home if that's a language that's different than English? Do you want somebody that's older, or do you want somebody that's younger and closer to your age? These are very kind of sort of basic questions, it feels like, but for a kid, these are the things that open or close the door immediately.
It can be challenging to figure out how to even talk to your teen about mental health or how they're doing, right? It can feel like nothing you say is the right thing, right? Mm-hmm. Or nothing you do is the right thing. And what I found to be a pretty effective strategy that, is across the board is really just leading with that vulnerability that we all have of what it takes to be a human being, right? And not thinking so much about it.
I think we gave lots of good tips.
Yeah.